Hello and welcome to my YouTube channel. We get to learn a lot of new things every day, especially about our health, our menstrual hygiene, menstrual health, public health in general. And this is still your host, Adiola Idowu, back with you today on another wonderful topic. Today we'll be talking about how the menstrual cycle change with age. Okay, so we're looking at the changes that goes on in our body from the onset of menstruation, that's menarche, to menopause. During growth, we have a lot of changes that take place in the body, the skin color, um, our skin itself, the elasticity, our metabolism slows down, even our emotion becomes more mature, and of course our period changes too. And you know that our period is regulated by hormones, and so the levels of these hormones in our body also tend to change at these different phases of our life. So just natural that our menstrual cycles will also change even as we go. All right, so really there's nothing like a normal period to know, okay, what exactly has changed. But there are certain things that are generally acceptable for a healthy period. For example, a complete menstrual cycle is between 21 days to 35 days. I'll say 21 and not 25, in length. And we have a monthly bleeding that lasts between 4 to 8 days. And the amount of blood lost during one period should be around 80 milliliters, 80 mils, that's about 2.7 ounces of blood and tissue. On a healthy basis, a menstrual pad shouldn't need to be changed less than 4 hours. If your pad soaks so much that you have to change a pad per hour, what do I mean? One pad, you have to change it after about an hour or even less than 2 hours, then it should be a cause of concern. Okay, one for a lot of quick tips. I like giving us tips, and today our tips are going to be describing some menstrual terms that are used to describe menstrual periods. And please subscribe to this YouTube channel. The link is here below. Please subscribe and like, share with others. The more informed they are, the better they will be at living the best life. So the word menarche, I'm sure many of us have heard it before. It is the age when an adolescent girl begins to have a period. That is what is called menarche. All right, and then we have amenorrhea. Amenorrhea is when the period is irregular. It could be primary, when someone doesn't have a period for 6 months or more. If it is at menarche, that is when an adolescent girl just begins to have a period, then that's the primary one, and it's no cause for alarm. It's just the body trying to get used to the production of the hormones and the release of the egg on a monthly basis. So that's primary amenorrhea. And then the secondary one is when a woman who is not at menarche just stops having a period for 6 months or more. Okay, and then we have oligomenorrhea, which is when there is infrequent periods that occurs at intervals greater than every 35 days. I told us like healthy period is between 21 to 35 days on the average. And when people or a menstruator have their own period at periods that are greater than every 35 days for up to 6 months, then the condition is referred to as oligomenorrhea. And then we have dysmenorrhea, when a woman experiences painful period. And when I say painful period is described as period that interferes with our daily activities. Yes, there is a period comes, there is the the pains, the PMS, and all that, and you might need to take pain relief. But when the period gets to, the pain becomes so much that a student can't go to school, a worker can't go to work, you're just all there turning and tossing and with a lot of tummy ache, and they'll tell you, that's the way it's been. No, it is not right. It's called dysmenorrhea, and is the reason you should be seeing your doctor immediately. And then we have the perimenopause. Perimenopause is the period of time that is leading up to menopause. Okay, it differs from one person to another. In some people, it lasts just few months, while in others, it lasts up to years, even more than 10 years. So during this period, the woman stops ovulating regularly, not altogether, and then she has regular cycles, and she may also experience some periodic symptoms of menopause, including the hot flashes. And then we have the word menopause itself. Menopause is the time when the ovary cease to produce adequate hormones that leads to no period for more than a year. Okay, and it has its symptoms. And I'll be doing more videos on menopause. The symptoms, what to expect, and how to manage it, because it actually comes with a lot of challenges, emotional, physical, even in the health. So we need to know. So please don't forget to subscribe to this page. Thank you so much. All right. So having said that there is something like LD period, how then do I know if there is a problem with my period? How do I know? Yeah, if there is any change outside the parameters we mentioned above, okay, if there is any change without an obvious explanation, please do mention it to your doctor. Okay, tell your doctor about any period or any bleeding between periods. Okay, tell your doctor about any excruciating pain if it's too painful. Okay, please tell your doctor about it. If the number of days is more than the normal or less than the normal, you might just want to talk to the doctor. Okay, let's note that during the lifetime, during our reproductive lifetime as menstruators, the menstrual cycle and period will change. Okay, it will evolve, and the cause of the change, of course, includes age and hormonal changes and factors such as stress, lifestyle, medications, and also certain medical conditions. Okay, but what is normal between different ages, okay, and different phases? What is normal and what should you be concerned about? And that is what we shall be looking at more in this video. So we should be looking at the things you need to be expecting and the things you don't expect throughout your menstrual cycle. So, of course, we'll start with the adolescents. And one very interesting or important factor that affects them is a young girl's BMI, that's the body mass index. And a simple way of calculating the body mass index of an adolescent, of a girl or anybody at that, is the ratio of the weight and the height. How do you do that? The weight, you get the weight in kilograms, and you divide it by the height in meters square. So get the weight in kilograms, get the height in meters square, and then divide the weights by the height. Okay, so generally menarche starts around the age of 12 to 13. Okay, years on the average, although we have been having there's the incidence of having early onset nowadays, a lot more now. It's not as if it's totally strange, but more of it is occurring where we have girls setting on into adolescence at ages less than 11, 8 years, you know, and it's these things are caused by factors including the feeding, the weight, the environment, and all sorts. But on the average, between 12 to 13 years, a girl starts menarche. And if a girl by 15 years has not seen the first period, okay, then the girl should be seeing a physician. The girls should be seeing a doctor to know what is wrong, something is not right somewhere, which needs to be corrected. Menarche starts around within 3 years of breast development, around 2 years after your first pubertal hair grows in the vulva area. Okay, so around that time, menarche starts. That's when the hormones will be releasing, will be leading to ovulation, egg release, and then by the time there's nothing to fertilize it, we'll have the uterus releasing the blood and the tissue which it has been preparing for the egg. All right, so it may be regular at first. At menarche, it's usually irregular at first, as much as 6 months passing between periods, and around that time, the period can still be within the range of 21 to 45 days. 21 to 45 days, although there might be shorter or longer cycles. So, but at that time, we can't fix it between the 21 and 35 days period. It could be longer, it could be shorter. But by the 3rd year, most menstrual cycles of a typical young adult will have regularized. Then you will have 21 to 35 days, or let's say 28 days on the average. And then each period will last between 2 7 days. Anything on that average, with the average of around 5 days. Okay, so by the time we get into the 20s, the late teens and the 20s, that's another phase. The period will become more consistent as ovulation becomes more regular. Okay, and then the symptoms, the PMS, the cramps, the breast tenderness, and so on, the emotional changes and all that, you may start to experience them more. Okay, and also because this time is a fertility aid day, more menstruators, more women get more comfortable with period and sex and all that. So it's a time when many women decide to begin birth control pills, BC pills, or other forms of contraception. Okay, it is what they know. Contraception can change our periods. It can make it shorter, lighter, more regular, or longer. It can bring more cramping or reduce the PMS symptoms. Okay, and different contraception options will have different impacts on the menstrual cycle. Okay, so you should meet a physician who will be able to discuss the different changes with you before deciding on the contraception option. And in addition, you should be aware of the menstrual side effects from each of the different forms of contraception you may have. So once you are aware, you know what to expect and how to handle it. But you should know that contraception does impact the menstrual cycle. Yes, into the 30s, where you become more, the periods become more predictable, more consistent, we may have some conditions showing up in the 30s, including things like fibroids, polyps of the endometrium or cervix, and sometimes some of these conditions may make the period heavier and cause more painful cramps, and you may experience intramenstrual bleeding. Also, and many more women are having children in their 30s than earlier. So you should know that at whatever time you decide to have a baby, from menarche to menopause. Menarche to menopause is actually the reproductive years. So at whatever time a woman has a baby, your cycle, your menstrual cycle can change, because having a baby, reproduction impacts on the menstrual cycle as well. Normally, your period won't return until about 6 weeks, 4 to 6 weeks after delivery. And if you are breastfeeding, you may not even return until you stop breastfeeding. Some people are able to use that as a form of contraception. While for some people, the 4 years, 4 to 6 weeks, the period has returned. Okay, and some women will experience heavier period, longer period, or more painful periods. While for some, their period symptoms will improve after having a baby. And luckily, I fall into one of those categories of an improvement in my menstrual symptoms. Okay, the pains, in fact, pains are not even like non-existent anymore. And then yes, what I'll just notice is that I feel the need to wee, and then it is there. If I'm not doing any calculation, I might not even feel any cramps like that. Okay, after that. So just know that giving birth to babies affects our period. Then in the mid to the late 30s into our 40s is the period known as perimenopause. Okay, and like I told you earlier, it can last for a few months to more than 10 years in some people. Okay, and what is the cause? Because it is caused by the amount of estrogen produced by the ovaries, a reduction, a fluctuation in the amount of estrogen produced by the ovaries. So it may lead to not ovulating regularly. Okay, and the common symptoms includes a change in the menstrual cycle, the length, and periods that are either shorter or longer, lighter or heavier than usual, and you may even begin to skip periods. And you may also experience hot flashes, sleep issues, vaginal dryness, urinary issues, and a lot of other emotional changes. Okay, and that leads to the 50s, where most women will experience menopause. The average age is 51, and anything between 45 to 55 is a usual. A good way of knowing is if you're able to ask your mother when did she have hers, it's a good indicator of when you will have yours. So there are a lot of factors that impacts the age of menopause, and one of them include the number of babies you've had. Don't forget I said having babies actually impacts our menstrual cycle. So the number of babies, meaning those that have more babies, tend to have later menopause. And then tobacco users may also have the menopause earlier. Okay, then the ethnicity. Our ethnicity also affects the age of menopause. African American and Hispanic women, they tend to have earlier menopause than Caucasians. And it's a time to invest in a lot of lifestyle management, because menopause comes with emotional and physical changes, with turbulence. Let me say emotional and physical turbulence. Okay, because of the changes, the hormones and all that. So I think I said it earlier that I'm going to make a video about that. So we'll delve into what to expect at menopause more in that video. So please, if you experience bleeding after menopause, you might want to talk to your doctor right away, because it could be something serious like uterine cancer. All right. Yes, your period says a lot about your health, about your overall health, and please pay attention to what is normal for you, so that in case there is a deviation from the norm, you'll be able to detect it earlier, and you'll be able to report it to your doctor for early treatments. Okay, and finally, or in closing, I want to urge us, as long as you are sexually active or you are over 21 years of age, please let the gynecologist visit. Let it be a yearly routine for us. Okay, let it be part of our routine checkups for screening and checking our reproductive health. Okay, because your period actually can tell a lot about your health. Okay, thank you very much for watching, and please don't forget to subscribe to this channel and share. Please also press the like button, and thank you very much. Like I always say, knowledge is power.